Hello, I am Jane Felgen, President of Creative Healthcare Management. Relationship-based care. Many ask, what is it really? Relationship-based care is several things. It is a philosophy that the patient and family experience is our core business focus, and that relationships are core to caring. It is a model with 8 dimensions for transforming care delivery in ways that honor relationships with ourselves as prelude to those with colleagues, patients, and their loved ones.
I am Keith Fenstermacher, President and CEO at Fax and St. Luke's Healthcare in Utica, New York. I think what drove me to try to get to a point in the organization where the patient was at the center of everything was my own personal journey. And I remember distinctly being at a meeting, and it was a national meeting someplace, and a gentleman came out and he was dying of a very serious disease. And he said to the audience, and there was probably 500 people in the audience, he said that as I end my life, I want to be someplace where people will love me and love my family. I said, what does that mean? And then about 6 months later, I was at another seminar. And it was at the end of the series of meetings. It was 3 days. And the very last session was for chief nursing officers. So I thought to myself, well, that would be an interesting meeting to go to. Suspecting that I would probably be the only chief executive officer in the room. And I was. And I went. And the nurse executive who was speaking said that what this was all about in terms of delivering care to patients was allowing the nurse to know the patient and to know the family. And it was like somebody turned a light on, because I immediately linked knowing the patient and knowing the family with the gentleman who said, I want to be loved as a patient, I want my family loved. And then I understood that you can't know the patient and you can't love somebody unless you have a relationship with somebody. And then relationship-based care came on the horizon, and it was just a natural, it just fit. It drove everything to the patient, drove everything to the family of the patients. And in the organization, if you can't organize around allowing the nurse to know the patient, then you're not doing the best you can for the patient. And your whole organization has to allow the nurse to know the patient, to allow that nurse to have the relationship with the patient that can take it to the highest level of care for that patient and the family. So that's what drove me. That was kind of my personal journey to understand what all this meant. I've been a CEO for 30 years, and one of the biggest frustrations I've had, and actually it's some baggage you carry around because you live in the front office, is that all you care about is finances. And now I recognize that that comes with the territory. And what has finally broken through for me is that I can always say I care about quality, but I've never had a symbol, I've never had a platform to work off of. So even though I say it, I'm sure there's people who think it's artificial or it's being fabricated, or when he goes back to the office, he's going to pull out pieces of paper and all his paper is going to have on his numbers. And it doesn't work that way when you get into RBC, because if you're really participating and you're driving it, and as you own it, you have a wonderful platform to create a whole new image or a whole new concern in the organization of what's important to you. And if you really do live RBC and you believe in relationship-based care, it is a great way to work in your workforce, to support them and to give them the sense that you're supporting relationship-based care, because quality is important to you as the administrator of the hospital, and it really starts there. And it's the greatest opportunity I've ever had, and I'm using it, I'm leveraging it, I'm creating a whole different, I think, relationship between the front office and what's going on the floors. And that's just a great opportunity for any CEO to finally get that platform. I think the greatest indicator I had when RBC was taking hold was on a very personal basis, where my father was admitted to the hospital. So obviously I visited him several times while he was in the hospital, and about the second day I went down and we're doing a little test. And so I said to Dad, hey Dad, who's your primary nurse? And my father didn't quite understand what I was asking, but as I asked the question, his nurse walked by the door to the room. And he caught her out of the corner of the eye and he said, there goes my nurse. And so immediately I felt, my father does know who his nurse is. And that was the critical test for me. And my father being 88, that had registered with him. So the next day my father was discharged, and I went back to the unit, and obviously to express my appreciation for the care my father had received. And I walked by his primary nurse, and I said to her, thank you so much for taking care of my father. You did a great job, and he's going to be fine, etc. And oh, by the way, I wanted to let you know that while I was here visiting, I did do a test, and I wanted to make sure that he knew who his primary nurse was. And he didn't know you by name, but as you walked by the door, he pointed you out, and he said, there goes my nurse. So I looked at her and I said, it's working. And she didn't say anything to me. She just looked at me and she gave me a high five. Boom. And she walked away. And I thought, wow, that's the test. And that's now resonating in the organization. She had as much pride in the fact that it worked as I did when my father was able to tell me that.